Peace and blessings. This is James Sutton. I'm a long person in long-term recovery. Today, my guest from New York is Sam Rivera. He's the executive director of OnPoint. Welcome, Sam.
Thank you. Thank you so much. Appreciate it.
So what is OnPoint?
OnPoint is a multifaceted harm reduction, OnPoint NYC, multifaceted harm reduction organization located in New York City. We've been in operation for over 30 years, providing a variety of services for folks who, for a variety of people, not just folks who use drugs, but community members as well. We are mostly known now for opening and operating the first 2 overdose prevention centers in the United States. But we also have a variety of other very crucial services, case management, mental health services, low threshold medical services, respite services, HIV testing and treatment, hepatitis testing and treatment, Suboxone treatment as well. We have a very well staffed and amazing holistic health program, which includes auricular acupuncture, full body acupuncture, Reiki, and other sound therapy and other forms of holistic health. We are an SSP, a syringe service program. We offer showers and laundry services to our participants. We have a drop-in center, which is like basically we look at the entire organization as a drop-in, but we have one location where folks gather. We serve, I like to say 5 meals a day because we serve 3 meals a day, but we feed people when they're hungry, unlike the traditional organization where if you miss lunch, you have to wait till dinner, or if you miss breakfast, you have to wait. For us, we move as indigenous folks, as African folks. If you walked into a village in Africa and you were hungry, they don't tell you to wait for dinner. They feed you. And the same thing on a reservation here in this country or other countries where indigenous people are. If you come in and you're hungry, we don't say you just missed lunch, you have to wait. We feed you in that moment. We also have a very an amazing outreach and public safety team that works in the community, responding to overdoses in the community, responding and supporting folks in encampments and parks, and also collecting hazardous waste from a variety of places or as needed when people call us.
Wow, that's a vast array of services, man. Man, you guys are covering a lot of territory. Now, how did you get into this? You said how long have you been doing this?
I've been in this work 32 years.
Wow.
Almost 32 years. Yeah, it's been a while.
So how did you get into this work?
So I got into this work on a personal experience. I actually started in HIV. I actually started in the work before we called it harm reduction. I was in the penitentiary in the mid-'80s, and I happened to look into a room where I saw men who were all in white, looking very, very ill, and didn't realize what was happening. Short version of a very long story. The officer said I looked in and I now have this disease that's in my eyes, and I was put in quarantine and told I would have to sign forms saying I put myself at risk for this disease and I can't sue the state, etc. And then the next morning I called my mom, who's a nurse on the Lower East Side of Manhattan in New York City, told her what was going on, and she said that's HIV, not to worry about it. So that became, I went from being quarantined and told I'm going to die to actually spending the rest of my time in prison, working with these men, helping them live with some dignity. I worked with a nun. We were the only 2 that would enter the room. Anybody else who entered with hazmat suits, and they were afraid to even get near these guys. For us, it was an opportunity to read letters for them, write letters for them, just interact with them in a humanistic way and support them. So then when I left prison, I went to an organization called the Fortune Society, and they had just started an HIV program. And I said, I know some stuff about HIV. And I got my first job in 1992 as a case manager at the Fortune Society.
Wow.
So I would go to work And then after work, a lot of us who didn't, again, were doing harm reduction work before calling it, will go out to what we called back then shooting galleries and clean syringes by hand with bleach and water, just to do everything possible to prevent the spread of primarily HIV. And then from that, we started to realize we're doing harm reduction work, and so that was the beginning of my time in this work. Yeah.
Wow, great story, man. We're so glad that you chose this field, you know.
Thank you.
Sounds like
Thank
you're
you.
doing some great work in New York. And really, since you're a model, because you know your program is the first in the United States. You know, years ago, you know, started watching the one in Vancouver and paying attention to them, but you seem to taken theirs and expanded on the services that they offered, you know, and they're still doing well too. I mean, I think last time I checked, they had like over 5,000 people overdose, but no fatals, right? It was something like that. It was a
Right.
really great
Right.
number. No overdose after, you know, that many people coming in as you
Oh
know.
yeah.
And so, how long have you guys been open?
So we've been open 2 years. Just on the 30th of November, we celebrated around 2 years. The
30th of
blessing we
November.
had when, yeah, the blessing we had when we opened is our senior director of programs, Kaylin C, operated OPCs in Canada. So she brought that experience over to us, which allowed us to really expedite the process and open a lot faster and sooner than we would have been able to. But yeah, and similar numbers. We have 4,300 registered participants in the OPC. We have two different OPCs, two different locations,
Right.
and we've had over 1,300 overdoses with 0 deaths as well. We are
Fantastic.
being careful. It's wonderful. One of the things we've been talking about lately is being careful about like really pushing to 0 because things can happen, right? And we want to be careful that if we were to have, unfortunately, you know, by some chance have a death, it would mean somehow we're failing, right? But it doesn't. I mean, if you think about all of the years in this work, all of the for us so far, we've had over 100,000 utilizations. So in 2 years, 4,300 people used the space over 100,000 times, which is like just an
Yeah, that's
astronomical number.
true.
And knowing that within that we haven't had a death, or the other side of it is also the amount of services they've been connected to. You know, you mentioned something really important for me and for our organization. It's important to continuously answer the question of what's missing in the organization, right? So we have uh, on occasion we run a gap analysis, right, to see what's missing,
Mm,
what is
mm,
it people need, which is how we went from having some programs to more programs to many more programs and more coming. Um, it's not that we want to be all things to all people, but we also know that active drug users aren't welcome many places. So it's important for us to create the safest and most comfortable place for them to land and support them through that process. And then the next piece of that is when our folks get comfortable and in using services with us, then they feel more confident in going out and receiving services in other places, being able to advocate for themselves
right.
in that way. And you know, as a person in recovery, the beginning is very scary to do things if
Mm,
you choose to stop using and starting over sober, you know, is can be very challenging. So as our people become healthier and healthier, we want to make sure that they're able to navigate these systems in the best way possible.
right, right. And you're doing, sounds like you're doing a great job too. And we're trying to, and look, the whole country and the whole world's paying attention to. We're trying to learn from your model, right? So I was
Yeah,
reading an
that's a blessing
article from
too.
the New York Times from when you opened, and it was saying like at the time, every 4 hours, there's a fatal overdose in New York. Uh,
Yeah. It, it's down to every 3 hours now,
okay,
unfortunately.
it's down to every
Yeah,
3 hours. That's still, you know,
yeah,
pretty sad. You know, it's pretty
it is.
tragic
Mm-hmm.
because, you know, we have a lot of pushback about even syringe services, you know, in
Right.
DC and Montgomery County. And you guys not only have a syringe service or what they call a needle exchange, but you're actually inviting active users in your house, and you know, providing nurses to show them how to fire up safely, care for their wound. You know, you're helping them, and you know, a lot of the public will say you're helping them use, right? Right?
Yeah.
How would you respond to that?
Helping people who are currently using, right? These are folks who are currently using. So we're not helping new people. We're creating a safe space for them. We're creating an environment where when they're using is also less risky, right? We know that active users are oftentimes running into a space or into an alley or into a bathroom to use quickly, and a lot of mistakes happen as well. The other side of it is the perception that we're enabling is pretty sad. You know, I respect it to a certain extent because of how people see it from a distance, and most people haven't lived it. But knowing the pain our participants are going through when they're using, the reasons why they use. You know, people want to make this simple. You know, like people are choosing to use. We know that most people are using to self-medicate pain, trauma, mental health conditions, and more. And so being able to create this space for them, which in addition gives them access to all of the other services we talked about before. Those are the moments when people can see themselves differently. Those are the moments when people can expedite a process for themselves, right? You're coming into an organization, you're getting a meal. You might take a shower, you start feeling better about yourself. Those are the moments when people choose to have this relationship with themselves in a way they haven't been able to in the past. So as an example, when someone's using a booth, there's a big mirror in front of them. Almost everyone initially they don't even want to look at the mirror. They don't want to look at themselves. They really, you know, the way they see themselves isn't healthy. And then through time, they start to not only look at themselves, but speak to themselves. You know, we've had women come in who didn't want to look at the mirror, who are using the same mirror to put on makeup. Men who are using the same mirror to look at themselves. And you know, just having this relationship with self is really, for me, in my 3 decades of this work, when I've seen people make a change, any change that's best for them, any change they choose to make, the foundation is what matters. Too many people want to rush people into getting their stuff together and their opinions of what that looks like. The reality is our people need time to do it when they're ready and in the healthiest way possible.
Right. Well put. Hey, look, in thinking about interviewing you, we're getting ready to take a break, but listen to this that somebody sent this to me, I think it was like last week. It says like, when a flower doesn't bloom, you fix the environment in which it grows, not the flower.
Exactly. Woo! I love that.
Yeah, just somebody sent that to me just last week, and it kind of coincided with my interview with you, right? Because you guys are changing the environment so that, you know, the flower can grow, you know?
Wow.
So I think we're going to take a break right now.
Okay.
And then, this is James Sutton. We're on Road to Recovery. My guest today is Sam Rivera from OnPoint, and we'll be right back.
I'm an ex-drug dealer, and I'll be your sub today. Can you see anything different as a pill?
No.
You don't know?
Fentanyl is being mixed into everything now. There's only one thing that will save somebody's life. That is naloxone nasal spray.
Fentanyl, it's cheap, it's potent, and it's profitable.
Why would drug dealers put a lethal dose of fentanyl in drugs if they know it's so harmful?
Really just all about the money.
I just didn't realize that one pill could change your whole life.
More kids should know.
Welcome back. This is James Sutton. Today, my guest, Sam Rivera from OnPoint in New York. So Sam, you were just saying how you understand the pushback from some people that don't really understand the pain that active addiction brings, but you're providing like an opportunity for people to get into a new environment where they can see some other choices. I know the treatment community needs to pay attention to you guys because, I mean, traditionally, the data in the treatment community says that only 10% of active users actually make it to treatment. But that means that's 90% of the United States being underserved. Right. So I think programs like the program that you have and the services you're providing is an open door. Mm-hmm. And that's building, the guy that helped me get clean, named Rico, his main thing was relationships. If we have a connection and a relationship with someone, then, we can talk.
Yeah. 100%.
Now, I had another question for you because I was kind of puzzled in reading some of the articles about your opening. Some of the critics were saying that because there's so many treatment centers in your area, that's why so many people use it. And usually people, we need more treatment centers down here because people go to jail instead of treatment in Montgomery County and DC. They don't go to jail in New York.
Well, that's not, no, many go to jail. There's this, belief that, what people see in front of them is what tends to bother them. And the average person who makes the comments, you quoted, they don't really care about where people land, right? If they end up in jail, that's fine, as long as they're not in their space, as long as they're not on the corner or on the block. And for me, the piece you ended with before about the flower makes so much sense, right? Like if we're healing a person, we have to heal the community. If we're healing the community, like what does that all mean? One of the things I said about, to the critics you mentioned, we have gentrifiers coming to neighborhoods you're talking about, like neighborhoods we live in. And these gentrifiers tend to convince our folks to participate in that dialogue, which is dangerous. And I've told our folks that if you continue to participate in that dialogue, which also includes the possibility, or at least their goal, where they would like us, the organization, to leave, I've told our people, pack your stuff because you're going to leave with us. This is not about supporting our people. This is about bringing in new people into our neighborhoods, right? I grew up on the Lower East Side of Manhattan. Where I grew up, I couldn't live today because of this very thing. But we allowed people to gentrify their way in, take over our neighborhoods. And too many people thought it was for the better and found themselves moving out because of high rents, et cetera. What we know in this country is that there's no war on drugs. So when you hear people say no more drug war, what they're really saying is no more drug war on human beings, right? The perception from the government is that there's a drug war, but there isn't. Drugs are allowed to enter certain neighborhoods, very specific neighborhoods. Those people use and sell those drugs and then are held and then are punished for doing so, right? When you think about drug use across the spectrum, when you think about drug use in other neighborhoods, I've had so many friends of mine who grew up in affluent neighborhoods that say, my uncle and so many of my friends were sniffing cocaine all the time and nobody ever raided their basement or ever raided the corner pub where everyone knew the coke dealer was, right? It's a very clear and profitable process for certain people. This is modern day slavery. And this is about, Black, brown, and poor white folks around this country. And so when other people see a neighborhood where they believe looks good for them, they come in and then want to change the roots of who we are. And so if we're going to treat folks the way they deserve to be treated and view them as humans, as the beautiful humans they are, then you're right. Then we treat the whole entire community. And while I respect the initial reaction, the confusion about what we do, once people visit, they change their perspective. And if they don't, And clearly they have a thing that's very personal. They're not ever going to be someone who can really see the beauty in people. My brother's been in recovery now going on 30 years. And there was a time where, you know, people didn't want him around and people mistreated him because of his drug use. And now this is the guy who runs regional meetings and holds for their annual conference, holds $40,000-$50,000 in his bank account. These are the people we're working with. These are the beautiful people we serve. One of the other things I really tend to realize in my 3 decades of this work is many people are afraid of drug users or people who use drugs who get their lives together because they become some pretty amazing, powerful people.
Yeah.
And so keeping those folks down is part of the process as well, right? I mean, you've been in this process for a long time. I'm sure you know many people who have grown a relationship with themselves in a way where they have become some of the most beautiful, most amazing people on this planet. And what they needed was a little bit of love and respect. At OnPoint, we love on people until they're ready to love on themselves, whatever that means, whatever it means. These are people in pain. I've yet to have one person come into our site, use on site and go, man, I'm high, I'm feeling great. No, the reality is they come in pain and they use to be able just to manage themselves through the day. That's how deep and painful this process is. But if you're going to speak of it from up here, from 30,000 feet away, and give your opinions, then we ask you to move over and let the professionals do what we do. We happen to be in a field where people who have never worked one day in this field think they're the professionals. And that's a tough it's a tough thing to balance.
Right.
But my 30 years speaks differently, and I've seen my own experience personally. If you ask people who met me when I came home, I was an angry young man. No one could talk to me about anything. And because people started to treat me and come to me in a way that was respectful and cordial and caring, it changed me. And so I'm blessed to be able to offer the same to thousands in my career. It's a blessing for sure.
Right, truly. And to add on to what you're saying, when I remember years ago, I looked at the data of syringe exchanges, worldwide, and it was saying that actually the neighborhoods around the sites actually became cleaner. That because the parks started having less syringes in the sand where the children played. And the alleys, the neighborhoods actually got cleaner by the addition of the site. It didn't get worse. It actually got better.
Well, actually, a study just came out about crime in the very neighborhoods we're in. Crime went down. And the other thing is, you're right. We have, if you look at 100,000 utilizations, that means 100,000 times people used indoors. They didn't use in your community. They didn't use in your alleys, your parks, your local bathrooms, etc. We also collected and disposed of properly over 2 million units of hazardous waste. If we're not there, that's not happening, right? You mentioned parks. A month after we opened, so prior to us opening the OPCs, we had 13,000 syringes collected at a park across the street from our site in Washington Heights. 13,000 syringes a month, every month, 13,000.
Wow.
A month after we opened, it immediately went down to 1,000 syringes.
Wow.
That same summer, the park, the corner of the park is the children's playground that's been closed for years. And for the past few years, they've been saying it's been because of drug use. That same summer, that park opened. And I got to walk the staff over to the window and as kids were playing and say, listen, this is the impact you've had. That park reopened because we opened an OPC and you're loving people and bringing people in who just want to be loved and want an opportunity to manage life in a very different way.
Wow, great job, man. Great story too. Everybody loves the kids, right?
Yeah, I mean,
So, and everybody wants their children to be safe, everybody wants that, whether you
exactly.
Yeah. So let me ask you this about the feds. You know, I was reading another article was saying something about there was a law or something called the crack house statute or something.
Yeah. So I'm glad you brought that up because we in harm reduction, we have been speaking about the crack house statute and taking too much ownership for it and saying that's what within the crack house statute is what we're doing. That's what makes our work illegal. And guess what? We're starting to shift because we have yet to have anyone show us exactly what it is we're doing that's illegal, especially within the crack house statute. We just don't see it. So actually moving forward, we're not talking about it because it doesn't align. Our work doesn't align with what's in the crack house statute. And one of the things that you're also referencing was a comment made by Attorney General, who I for me, I digested his comments very differently. For me, he was leaning on other folks to create the protection we need to support us in the healthiest way, knowing the outcomes we're having, and then says, and if not, I'm willing to do my job and do these things. He's a law enforcement guy.
Yeah.
For me, I focus on what he said. Provide the protection. Tell me they're doing the right thing so I can move on and focus my efforts elsewhere. For us now, 2 years into it, the amount of people who have come through, the amount of beauty we've seen, the reunification of families, so many things. And, you know, one of my biggest ones is every time someone asks to be connected to treatment and detox, we connect them 100% of the time. So as harm reductionists, we don't talk about it all the time to our participants. They hear it everywhere. Interesting enough, they talk about it to us all the time. Sam, one day you're going to see, man, I'm ready. I'm getting close. And I'm like, whenever you're ready, we're ready, right? Let them lead the process. And then they get there and say, hey, I'm ready today. And when they say they're ready, we get on a call. We get somebody to pick them up right away and connect them immediately. I'm blessed with the most amazing team on the planet who does this work purely from the heart and the soul. It's really, really a blessing to lead this organization and to lead this movement in that way.
Thank you, Sam. So look, we got a couple of minutes left, right? And I got so many questions. But one, since what you were just talking about, so you guys have treatment on demand?
Oh yeah. Once someone wants, we connect them immediately. Yeah.
Oh, that's great, because treatment on demand is hard all over the country, right?
Oh yeah.
And the second thing is, what's your next steps? Because I know Impact added a detox upstairs and then transitional up top of that, right?
So that's oh man, James, you're amazing. So at our Washington Heights site, one of our amazing landlords, and we have two great landlords, is adding 2 floors to our building where we're going to add detox, and then the next goal would be to get into the old school. If I did housing, I would like to do old school, what we used to call scatter site housing. So staff is on site 24 hours a day. It's a phased out process. So then by the time the person's ready to go into independence, they're really solid and have everything in order and not just moving them in right away.
All right, thank you. So any closing words as we end this session?
I for a session like this, I would ask people to look at you. I really would look at you and see the possibility in someone if you treat them, in someone who uses drugs, and the possibilities of where they can head in their lives. You want to know what it looks like? Look at James. I mean it. I mean, you want to know what it looks like? Look at my brother Juan. Look at people who the beauty that's in them, and then someone cares or someone sees something in them they don't see. This is the possibility if we treat people with love and dignity.
Right. And thank you so much. And I'll have you back and give my best to Kaylin.
Oh, Kaylin.
Kaylin C. Yeah, she spoke down here, and I was really impressed.
Oh yeah.
So this is James Sutton. My host today was Sam Rivera from OnPoint in New York. Thanks again, Sam, for coming. And
thank you.
We'll see you on the road to recovery.